So the occurrence, like I said, one of the biggest reasons I would say in India, it would be around 80 to 85% of the cases would be because of the human papilloma virus or the HPV virus. So the virus actually is like 200 different viruses, but you can divide them into low risk types. Low risk means that you may get infected. And there was recently a report that I was reading just literally like 2 days back, which said 1 in 3 men have HPV. So a lot of women are going to be exposed to HPV anyway. But these strains are such that our immunity is able to wash it off in a year or two. And that's why I said, it's a bit dangerous in immunocompromised women as compared to those, with good working immunities. So the other type are the high risk types. Now these are like type 16, 18, and there are many others around, 14, 15 different types. These are the ones which really cause the cancer. So they'll, cause metaplastic and dysplastic changes, which are basically changes that change, the way a cancer, like a cell is differentiated, but they will make it into an undifferentiated cell, which causes the cancer and the spread of that cancer. So yeah, this is basically the thing. And how does it present? It's very common, the symptoms. And one of the things I would like to, tell the audience is that if there are any such symptoms, you must rush to your gynecologist, your obstetrician, because it's really simple. So if a woman is bleeding during intercourse, if a woman is having severe pain during intercourse, if she's having any sort of bloody discharge with a very strong odor from time to time from the vagina, if she is having her periods regularly, but in between the periods there is heavy bleeding with a strong odor, or the bleeding goes on for a longer period of time, these would be the signs and symptoms where she should immediately rush, because even if it's nothing, it warrants some sort of checkup. So these would be the most common symptoms. And if there is a case of advanced cancer, unfortunately, it involves the urinary bladder, the urethra. She will have difficulty in urinating. If it involves the rectum, she would have lots of pain in the abdomen, difficulty while passing stools. There can be a lot of dull back pain, swelling of the thighs and the legs. There can also be general cachexia and fatigue and losing a lot of weight, which is associated with all sorts of cancers. So yeah, these would be, the kind of symptoms that you would see both in like the not very initial stages, but also the advanced type of cervical cancers.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.